Good afternoon, everyone. Thanks for joining the 2024 Qualified Clinical Data Registry and Qualified Registry Self-Nomination and QCDR Measure Submission Demonstration. During today's webinar, CMS subject matter experts will provide information on the QCDR and Qualified Registry Self-Nomination process for the 2024 MIPS performance period. This webinar will also include a walkthrough demonstration of the QCDR and Qualified Registry Self-Nomination forms available on the QPP website, as well as the QCDR measure submission form for those submitting QCDR measures. The presentation will then be followed by a question and answer session where attendees will have an opportunity to ask questions over the phone and through the Q&A box, and CMS subject matter experts will address as many questions as time allows. And if you don't catch everything during today's webinar, don't worry. A slide deck and recording from today's session will be posted to the QPP webinar library within a few weeks. And also, there will be a part 2 to today's webinar. On August 17th, we'll be holding a virtual office hours session for the self-nomination application process. So if we aren't able to get to your questions today, we do encourage you to join us for that. And with that said, I will now turn it over to Dr. Dan Green to get us started. Dr. Green?
Thanks, Matt. Welcome, everybody. Thank you all for dialing into today's webinar. We appreciate your attendance. I just want to be 100% clear, though, so for folks that that this webinar may not apply to so much, they're welcome to continue to listen in. But this webinar is really geared toward registries who report data to CMS for the Quality Payment Program, as well as Qualified Clinical Data Registries, or QCDRs. So if you are not planning to self-nominate to become one of these third-party intermediaries to provide data from clinicians to the program, again, you don't necessarily need to attend today's webinar. Again, you're welcome to listen in. We will also be talking about, the self-nomination process that these entities should undertake so that we're aware that they want to participate. We'll also be talking a little bit about the QCDR, Qualified Clinical Data Registry, self-nomination of measures that are not in the MIPS program that they want to be able to report or at least have considered by CMS. So I won't take up any more time. We'll turn it over to our experts. And again, welcome and thanks for dialing in. Anastasia?
Thanks, Dr. Green. We'll start with the presentation. So this is first our disclaimer, just to note that this presentation was prepared as a tool to assist our QCDRs and qualified registries, definitely not intended to grant any rights or impose any obligations. And although every reasonable effort has been made to assure the accuracy of the information of these pages, the ultimate responsibility for the correct submission of any type of data, self-nomination, QCDR measures, things like that, of course, we would encourage you to take a look at the other resources available on the QPP website. So just a disclaimer there. Moving on to the next slide and the agenda. So with that, we will cover a few different things during today's call. We will cover some self-nomination, generalized information, as well as do a demonstration. We'll also cover information for the QCDR measure submission, and then do a demonstration of that QCDR measure submission process as well. We'll also cover some resources and who to call for help if for some reason you are having any issues or have questions regarding this process. And then, of course, if time allows, we'll have a question and answer session to answer some of those questions live on the call today. We'll go ahead and move on to the next slide, where we'll see the title slide for that self-nomination information. So we'll jump right into that information here on slide 6. So a little bit more information about self-nomination. Organizations that do want to participate as a QCDR qualified registry for the 2024 MIPS performance period must self-nominate and successfully complete a qualification process. As briefly mentioned earlier, eligible clinicians, groups, virtual groups, subgroups, alternative payment model entities, also known as APM entities, that want to report for 2024 MIPS performance period don't necessarily need to self-nominate as they don't want to act as a QCDR qualified registry. Of course, they can participate through a QCDR qualified registry if they'd like, but will not need to self-nominate in that instance. Only those intermediaries that actually want to participate as a QCDR or a qualified registry would need to complete the self-nomination form. And of course, within the self-nomination form, we'll ensure that folks meet the requirements of that self-nomination. Additionally, just want to remind folks that the self-nomination window is open from 10 a.m. Eastern on July 1st of 2023 and will close at 8 p.m. Eastern on September 1st of 2023. As you can see in the box on this slide, there is additional information and resources that are available for download on the QPP resource library, including a 2024 self-nomination toolkit for the QCRs and qualified registries. So that is definitely valuable information to take a look at if you are planning to self-nominate this year. Moving on to the next slide, please. So now we'll get into a little bit more about what a a qualified clinical data registry is. A QCDR is defined as an entity that demonstrates clinical expertise in medicine and quality measurement development that collects medical and clinical data on behalf of MIPS eligible clinicians for the purposes of patient and disease tracking and to foster improvement in the quality of care that's provided to clinicians. A QCDR may be an entity with clinical expertise in medicine that has clinicians on staff with the organization that lends their clinical expertise in the work carried out by the QCDR. Also is an entity that has standalone quality measurement development experience. And then just to note, if for some reason as an organization you do not meet that definition or those statements I just referenced, we do understand that some entities may collaborate with an external organization for the purposes of data collection, calculation, or transmission of the data in order to meet that definition as well as the requirements of being a QCDR. Please keep in mind that a signed written agreement that is specifically details the responsibilities of both the entity and the external organization that makes up that collaboration is required to be in place by September 1st of the year preceding the applicable performance period. So for 2024, that deadline would be September 1st of 2023. On the next slide, we'll continue a little bit more information about the QCDR. As I just noted a little bit there, folks can, of course, collaborate, and this details a little bit more if you may need to collaborate. So intermediaries that may not have that clinical expertise in medicine or quality measurement development that wants to become a QCDR may collaborate with those organizations to do so. As an alternative to becoming a QCDR, though, those entities that do not meet the requirements of a QCDR or those that definition of a QCDR, those entities may actually seek to become a different type of a third-party intermediary, such as a qualified registry. As qualified registries do not require the same level of quality measurement, development experience, or clinical expertise within their intermediary. I also want to note that QCDRs do have the ability to support up to 30 quality measures that are not within the annual list of MIPS quality measures. We refer to those as QCDR measures, but please know that if you would like to submit a QCDR measure for consideration, the full specifications are required to be provided to CMS at the time of self-nomination, and then CMS will, of course, review those submissions to determine if they are appropriate for QCDR measure reporting. On the next slide, we'll actually go into the definition and information about a qualified registry a little bit further. So a qualified registry, as I mentioned before, does not require that same level of measure development experience or clinical expertise, but they are a data intermediary that does collect the MIPS data from those MIPS eligible clinicians and submits it to CMS on their behalf. Please note that that qualified registries cannot support QCDR measures. Only QCDRs can support QCDR measures. And also, if for some reason as a qualified registry, you do partner with another organization to meet the full requirements of a QCDR or just to satisfy all of the necessary needs throughout the year of a qualified registry, such as data collection, calculation, transmission, that signed written agreement policy I mentioned with the QCDRs is still in place here as well. So as a qualified registry, if you are participating with another organization, you are required to have a signed written agreement by September 1st of the year preceding the performance period, and that is noted within the self-nomination. So we'll cover that once we get to the demonstration a little bit further. Moving on to the next slide. CMS approved QCDRs and qualified registries are required to comply with certain requirements that are set forth by the physician fee schedule final rule. These are also detailed in the 2024 self-nomination fact sheets, which are available in that self-nomination toolkit I referenced earlier in the call. We'll go through some of those requirements in more detail in the next few slides, as well as continuing on this slide. So QCDRs and qualified registries are required to support the quality, improvement activity, and promoting interoperability performance categories. So they are required to support all three of those. With that said, though, you may be exempt from this requirement for promoting interoperability if your MIPS eligible clinicians, groups, subgroups, virtual groups, or APM entities are eligible for the reweighting process. You must also support MVPs that are applicable to the MVP participant who, on behalf of whose data you may be submitting. So if there are clinicians within your registry or QCDR, CMS would be expecting you to support any MVPs that are applicable to those particular folks. QCDRs and qualified registries may also support APP participants. That would be the APM performance pathway. And then we also ask that you support all measures and activities underneath the collection types, performance categories, reporting options, and participation options listed on the qualified posting for the entire MIPS performance period and corresponding self-nomination period. Withdrawing any of those activities or services, or completely withdrawing as a third-party intermediary for the performance period will lead to termination of your organization as a third-party intermediary. Moving on to the next slide. Moving on to a few additional requirements here. So in order to act as a QCDR qualified registry for 2024, you must have at least 25 participants within your registry or QCDR by January 1st of the year prior to the applicable performance period. So that would be January 1st, 2023 for consideration for the 2024 MIPS performance period. Please note that these participants are not required to use the QCDR or qualified registry to support MIPS data to CMS, but they must submit data to the intermediary for the purposes of quality improvement. Additionally, QCDRs and qualified registries must be up and running by January 1st of the performance period to be able to accept and retain data and to allow clinicians to be able to begin their data collection on January 1st of the performance period. A system that is not live at the beginning of the start of the performance period is considered non-compliant with this requirement. QCDRs and qualified registries are required to submit data via CMS specified secure method of data submission, such as the QPP data format. Additional information regarding the data submission methodologies can be found in the developer tools section of the QPP website. And of course, QCDRs and qualified registries are required to submit data on behalf of all payers and not just Medicare Part B claims patients. You must also retain, for MIPS purposes, all records or data for 6 years from the end of the MIPS performance period and comply with any CMS request to review the submitted data. So for auditing and MIPS purposes, CMS may request any records or data retained for up to those 6 years from the end of that MIPS performance period. And QCDRs then must provide access to review that Medicare beneficiary data on which the 2024 MIPS data submissions are based, or provide CMS a copy of the actual data if requested for validation or auditing purposes. Moving on to the next slide. So this slide will touch on the business associate agreements and clinician consents that we do require QCDRs and qualified registries to obtain. A business associate agreement is a contract that each holder who's planning to submit data through a QCDR qualified registry has authorized that QCDR and qualified registry to collect and submit data. The big component of this particular requirement is the BAA must comply with any HIPAA privacy and security rules, as we of course want to make sure that all of our third-party intermediaries have the necessary contracts or agreements on file to be able to not only obtain that healthcare information, and of course, even just the PII. We want to make sure you guys have permission to have that information, but as well as that process, that information. And then the clinician consent takes it a step further, where we do ask that our QCRs and qualified registries obtain the signed documentation to indicate each client has authorized the QCR qualified registry to submit their data to CMS for the purposes of NIPS. In the clinician consent aspect, this should be done at the level in which you're submitting data. So if you're submitting on behalf of an individual clinician, you should be collecting an individual consent. If you are submitting at a group level, a practice administrator may give consent on behalf of that entire group, virtual group, subgroup, and so on. Next slide, please. So this slide will touch on feedback reports as well as certification statements. So the feedback reports that QCRs and qualified registries are required to provide should be based on all performance categories submitted for that particular clinician. So if you're submitting just quality on that clinician, we would expect that there'd be at least quality feedback provided in there. On the other hand, if they've signed up to report all all performance categories through your QCR qualified registry, there should be feedback within the feedback reports for all performance categories. And that would also include if a group or clinician is participating using MVPs or through the APP or anything to that effect. QCRs and qualified registries must send that feedback out at least 4 times per year, and then also provide feedback to the clinicians, groups, virtual groups, subgroups, and APM entities on how they compare to other clinicians submitting the same measure activity within their program. CMS does not provide specific templates on what this feedback should look like, so that is something up to your discretion, but we just do need to make sure that those particular requirements that are set forth by the rule have been met. If for some reason you do have a real-time feedback dashboard available to your clinicians, CMS does ask that the QCRs or qualified registries still send out notifications 4 times per year to remind your clients that that feedback is available to them. Additionally, exceptions to this requirement may occur if the QCR qualified registry does not receive data from their clinicians until the end of the performance period. The certification statement then, this is something that you'll see within the self-nomination, so we'll get to that momentarily, but I will touch on it here. The QCDRs and qualified registries are required to certify or attest that all the data that will be submitted to CMS on behalf of your clients is true, accurate, and complete to the best of your knowledge. This certification applies to the data submission based on the acceptance of data exports directly from an EHR or other data sources. If for some reason you become aware that submitted data isn't true, accurate, or complete, corrected information may be submitted until the end of the data submission period. If for some reason false, inaccurate, or incomplete data is identified after data submission, you should notify CMS immediately. Next slide. Please keep in mind that to access these CMS systems and to act as a QCR qualified registry, a third-party intermediary's principal place of business or retention of any data must be based in the United States. CMS policy prohibits non-US citizens from accessing CMS IT systems and also requires all program data to be retained in accordance with the US federal policy. That would be the NIST Special Publication 800-63. Which outlines the enrollment and identity proofing requirements for federal IT system access. So access to the QPP systems would necessitate passing a remote or in-person identity proofing process that is Equifax or equivalent, a non-US US-based third-party intermediaries, potential lack of social security number, tax identification number, US-based address or other elements required for identity proofing or identity verification may impact the ability to pass those necessary background checks. And then the inability to pass those background checks and identity proofing may limit or fully deny access to the QPP. And additional information related to that can be found in the 2019 Physician Fee Schedule Final Rule. Next slide, please. We do want to touch on data validation. Another item we'll go through in the demonstration as well. However, there is one specific tab dedicated just to data validation, as obviously CMS wants to ensure that all data for being submitted for the MIPS program is true, accurate, and complete. And so the QCDRs and qualified registries are required to submit a data validation strategy for CMS review and approval during the self-nomination process. And this process will just explain the validation process for quality improvement activity, promoting interoperability data that's submitted to CMS. Please keep in mind that when that plan or that strategy is approved, the QCDRs and qualified registries must conduct that data validation plan for the 2024 MIPS performance period. And that is required to be done prior to any data being submitted to CMS to ensure that the data being submitted is accurate and fully validated before submitting. The data validation must include all performance categories for which you'll submit data and each submitter type for which you'll submit data, regardless of whether the clinicians are MIPS eligible, voluntary participants, or opting in. And you must also use clinical documentation provided by the clinicians for whom you're submitting data to validate that the action or the outcome of the measure or activity was actually occurred or performed. When that validation strategy has been fully implemented, CMS does ask for a 2024 data validation execution report that will include the results of your data validation implementation process, any results that you may have found. And that'll be due on May 31st of 2025. Please keep in mind that late, incomplete, or absent submissions of your DVER or the results for the required targeted audit constitutes non-compliance with program requirements and may lead to remedial action of termination of a QCDR or qualified registry. A DVER template to help with this process will be posted on the QPP resource library when it is available. Currently, there's a 2022 version on the QPP resource library. If for some reason you do want to take a look at that, as the 2023 version will not be due until May of next year. That'll be available after we close up more of our 2022 cycle. But you can certainly take a look at that in advance of when the 2024 version will be available. Moving on to the next slide. Another requirement that CMS has is that QCDRs and qualified registries must attend and complete training sessions and support sessions in the form and manner and at the time specified by CMS. With that being said, CMS will host a series of trainings that will consist of an annual kickoff, monthly support calls, virtual office hour sessions, and even public webinars and demonstrations, just like this call we're on today. Attendance requirements for each training or support session may differ, so it is communicated within the calendar invites as well as the materials for each session. We also distribute a flyer that includes information related to the schedule for those calls, any type of helpful hints on how to access, how to use the question and answer, things like that, but also it dictates that attendance information. Please keep in mind that remedial action up to and including termination as a third-party intermediary may be imposed if there are intermediaries absent from those mandatory trainings and support sessions. Once you are qualified as a QCDR, qualified registry, additional information will be sent out from the QCDR vendor support at gdit.com or registry vendor support at gdit.com email addresses. I will note that with that, there might be just helpful information that's sent out, but we will send out additional information related to those trainings and support sessions. So you may want to make sure that those emails are unblocked from your system so information isn't blocked by your systems. Anything including call materials, agendas, minutes, timelines, presentations, as well as other helpful information will be distributed from those mailboxes. I will also note, and we'll touch on this during the demonstration as well, that the distribution list for the 2024 MIPS performance period will be made based on the contacts provided within your 2024 self-nomination. So even if you have provided contacts in the past, we generate an entire new list because, as I'm sure you can appreciate, a lot of our distribution lists throughout the years changes significantly. So, by the end of the performance period, we usually have an insane amount of out of office I shouldn't say out of office, I apologize, bounce backs and rejected emails from emails that are no longer valid. Maybe the domain changed, maybe somebody changed their name, maybe somebody has left the organization. So each MIPS performance period, we do create a brand new distribution list with those contacts that you include on your self-nomination. So please, as you're drafting up your self-nomination, please include anyone and everyone you would like to receive any type of this documentation from the PIMS team for your QCDR qualified registry. Moving on to the next slide. So here is a requirement that's actually one that's been updated for the 2024 MIPS performance period. So starting with 2024, a QCDR qualified registry that was approved but did not submit any MIPS data for either of the 2 years preceding the applicable self-nomination period, so that would be 2021 and 2022, must submit a self-nomination participation plan for CMS's approval. This self-nomination participation plan must include the QCDR qualified registry's detailed plans about how the QCDR qualified registry intends to encourage the clinicians to submit MIPS data to CMS through the QCDR, the qualified registry. And there is a field within the self-nomination for that information, so of course we'll touch on that shortly as well. Moving on to the next slide here. We've talked about this a couple of times during the presentation today, but did want to provide some additional information on this. So we've mentioned that there's certain things that could lead to remedial action or termination. So to provide more information on that, CMS does have the authority to impose that remedial action or termination based on the determination that a third-party intermediary is non-compliant with one or more of the applicable criteria for approval, has submitted false certification, or has submitted data that's inaccurate, unusable, or otherwise compromised. QCDRs and qualified registries that do have remedial action taken against them will be required to submit a corrective action plan to address any deficiencies and detail any of the steps taken to prevent those deficiencies from reoccurring in the future within a specific time frame that we provide. Please note that the CAP is a corrective action plan, or CAP, CAP is what we generally refer to it as, must address the following items: the issues that contributed to the non-compliance, the impact to other clinicians, groups, virtual groups, APM entities, regardless of whether they're participating in the program because of the MIPS eligible or voluntary participating. And then also, if for some reason you are a QCDR who is granted the ability to have other QCDRs report your measure, and there's some type of an issue with the way those QCDR measures are being operated or something to that effect, we would also expect that the QCDR be notified of such. The corrective action plan must also ensure that the non-compliance area has been resolved and won't recur in the future, and include a detailed timeline for achieving compliance within those applicable requirements. Also, there should be a communication plan communicating that impact to other folks. Failure to comply with the remedial action process could lead to termination of the third-party intermediary for current and or subsequent performance periods. Moving on to the next slide. And that brings us actually to the next section of our agenda. The next section is for the self-nomination demonstration. So I will actually go ahead and share my screen here. Bear with me a moment, and we'll walk through the actual tool where you will be self-nominating. Okay. My computer should be sharing now. If for some reason you don't see it, feel free to break in and let me know. So what you're seeing here is just the qpp.cms.gov. To access the self-nomination tool, you will actually see there is a sign-in option right here at the upper right side. So when you click that, then you'll go to a window that says sign in. Now on today's call, we are not going to focus on the registration of a QPP account, but if for some reason you do not have an account already, please go ahead and use the information to sign in or register for a QPP account. And if you have issues, reach out to the QPP Service Center and they'd be glad to walk you through that. But we will bypass that for the purpose of today's call. bear with me for just one moment here. I'm trying to minimize this window. Well, let me just do this here real fast. So when you log into your self-nomination, you will actually see different options. I've already logged in to the system as an intermediary. I will note, though, that we are not in the production environment for today's demonstration. So while most of what you see is, of course, very similar to what you will see when you log in yourself, however, there may be slight differences. So we will go through what you'll see as you self-nominate and any fields that you'll need to populate. So here's your self-nomination window. As you can see, I'm already in here, and I've already got a few demo self-nominations prepared, but there is a blue area at the top here that says, self-nomination does open on July 1st, closes on September 1st. And then we will go through that qualification process and ultimately post an approved list of qualified QCDRs and qualified registries by January 1st of 2024. Of course, if for some reason we complete that process early, we will go ahead and post that early. Now, as we go through to self-nominate here, if you are a new organization that has to create a brand new self-nomination, you will need to add your own new intermediary. You will likely not see anything right down here. So what we'll do is we'll start with adding a new intermediary. You'll click the button that does say add new intermediary, type in your intermediary name, and then select if you're planning to be a QCDR qualified registry. Please keep in mind that if you want to act as both of those intermediary types, you will need to create two separate self-nominations. Now, if you are a QCDR qualified registry, you should already see your form within your self-nomination tool. However, if for some reason you do not, and you are an existing vendor, please do not just create a new self-nomination. Please use this option where it says intermediary not listed to find your self-nomination. And the reason we say that is because the current self-nomination for you is tied to the unique intermediary ID. It's that 7-digit number that you've used in years past. And we want to make sure that you're able to continue using that. So we want you to use that self-nomination to locate, that self-nomination tied to your vendor ID. So if your intermediary is not listed, please use this process. Go to the Find Your Registry page, search for your registry organization, and then request the security official role for that registry organization. If for some reason you still aren't finding it, please open up a ticket with the QPP Service Center, and we'll help you find that for your organization. With that said, we'll go ahead and talk a little bit more about some of these active demonstration self-nominations I have right here in the below. So each of these entities has various options. So we already have one here called Demo ABC QCDR. I will note if you click the little pencil, you can edit some of the information, including your intermediary name. If you select the eye icon, you can update the intermediary watchers. And then, of course, you'll see the reviewing watchers, which are the folks behind the scenes reviewing your self-nomination. But if you want other folks to be able to access your self-nomination for updating, checking comments, things like that, go ahead and add their email information into this intermediary watchers spot. Please keep in mind they will obviously have to have the necessary account in order to be able to log in. So please make sure to do that. And there is an option to print your self-nomination form. And then below there's some status information. So as you can see here, these 4 that I have displayed are new self-nominations I created for the purposes of this demonstration. But I will scroll down here a little bit and show you, you can see that some folks or some of these self-nominations will include a intermediary ID already, and those would be existing. So as a existing QCDR qualified registry, you would see a simplified form or a partially created self-nomination form with your intermediary ID already included. Of course, the intermediary ID here for these, since again, I just created them, is just marked as new. You can also see the status of where that self-nomination is. You can see how some of these have draft in progress, 66% complete, 7% complete, so on. We also have one that is marked as draft complete, and you can see the different icons associated. The yellow circle that's half completed obviously shows that it's in the works, whereas the green check mark circle means that that draft is complete. On this window, you also have the ability to click the edit button, which of course we'll do here momentarily, but also
I'm not sure I understand.
But also with that, we also have the option to withdraw the self-nomination. So if for some reason you have started a self-nomination and decide to withdraw that self-nomination, please feel free to click the withdraw button. And then that self-nomination will no longer be considered for the purposes of QCRs at qualified registries. With that, you can also see down here on the self-nomination that's been completed, there is a submit for review button clear over on the right side. So if for some reason you have fully completed your self-nomination, it's ready for team review, you can always just click that submit for review button, confirm that submission on the pop-up window, and then of course it will be submitted for review. And then you can see here the status has changed and that self-nomination is now in self-nomination review. Please keep in mind that you should submit that self-nomination by the deadline. That would be then September 1st at 8 p.m. Eastern. So please make sure you get that self-nomination statement in by September 1st at 8 p.m. With that said, we're going to go ahead and open up a self-nomination here and begin to edit. Now, for the purposes of today's demonstration, we will go ahead and go through some of these. I've pre-populated some things. I will touch on most of these fields in here, but I do want to reference that we do, of course, have a user guide available in that toolkit we mentioned earlier in the call. That is a great resource. If for some reason you're a new QCDR and this form is brand new to you, it might be one of those things that you do wish to walk through that user guide side by side as you're walking through this form and completing it, as that would be extremely helpful for you. I do want to note that towards the top here, we do actually have a link for guides and help where we have information that includes about and instructions for the self-nomination tool. We also have those resources referenced. So that toolkit I referenced, we do have the self-nomination user guide, the QCDR fact sheet, as well as a QCDR measure handbook if you are planning to submit QCDR measures for consideration. I do want to also note that for the purposes of the demo today, I am in a QCDR self-nomination. As you can see, the qualified registry and the QCDR self-nominations are very similar, almost identical, with the exception of the QCDR measures information that's specific to them. So you will see that we're reviewing the QCDR version just so we can touch on those QCDR only items, but we will reference those as we go through the call. So additionally, we obviously have a few other fields up top on that main menu bar towards the top. We do have an option where you can view and add comments. So this is actually a section we will use a lot in communication with you as you submit your self-nomination. As we review a self-nomination, we may go ahead and tell you something additional is needed, or we've accepted your self-nomination and moved it on to the next phase of the qualification process, or whatever it may be. You may also use this field to ask us questions. So if you have questions about a certain field, the status of your self-nomination, anything to that effect, please feel free to type it in there, and we'll just add a quick comment here just to show how it works. So of course you click the add comment button. There's a drop-down menu for what your topic is about. That makes it easier at the end of the self-nomination period, where we've gone through several qualification processes, to go back and try and find a specific comment that you may want to look for, or we may want to look for. So if this comment has something to do with self-nomination, we'll of course just select self-nomination, type in our question. We can attach files if that's something we wish to do, and then we can just send that comment. Once we have a lot of comments out here, like I mentioned, it may be one of those things we want to filter to specific topics. As you can see, the self-nomination topic will only come up for the self-nomination ones that we have sent. So those are the comments. You will get an email if for some reason one of our internal folks does post a comment on your self-nomination. So please keep an eye out for those comments. Again, sometimes we're requesting additional information. Sometimes we're letting you know the status of your self-nomination. It may be a wide variety of things. So please keep an eye on those comments and check them. That way we can continue to move your self-nomination forward as quickly as possible. With that, we also have some of the same fields that you saw on the last screen. So you are able to edit your intermediary name here, manage your watchers, and then you can also print. I also want to note up here that there is the button to save and close, but as you can see, all changes are also saved. So as you're typing in all of your information, the system does go through and save your changes. But of course, if for some reason you want to start it today, come back tomorrow, add some more information, you certainly can do that and use that save and close button. Next, we'll talk about our menu bar that goes down the left pane here. We have all sorts of tabs throughout the self-nomination that we collect information on various categories, and we'll go through all these in a minute. But as you can see, we also use very similar icons to what we discussed on the last page. The green circle with the check mark means that tab has already been fully completed. The yellow circle that's half shaded in is that field is, or that tab is partially completed. And then of course, these blank ones are actually marked as nothing is done on those particular tabs just yet. So you can see the statuses. Once all of the green items or all of the tabs have been fully completed and have the green check marks, it will actually let you submit for review. As of right now, it actually won't let you just because a full self-nomination is required. So what we'll do is we'll go ahead and populate some more of this information and then submit it as we were going to submit it. The next little section here on the menu pane here is the assignee. So once you submit your self-nomination, we'll assign it to a team member for review, and you'll likely work with that person for a short bit to get through the self-nomination review cycle and make sure that we can get all of the information we need and then hopefully accept that self-nomination. And then, of course, you'll see the draft status here. So currently it's in a draft in process. However, once you submit that self-nomination, that will change just as I showed on the last screen. As I mentioned before, the submit for review button is not possible at this point in time just because not everything is completed. However, once you do complete everything, that submit for review button will be available there. And then there's also an option to withdraw. All right, going on to the first tab, then we can get started. We'll go through briefly all of these fields that you required information. Of course, if you want more information on any of these fields, reference that user guide we've discussed. So the first tab, intermediary contact information. This will just give us the information related to your QCDR and your organization, and of course, a qualified registry for the qualified registry self-nomination. So we already have your QCDR name clear up here. That's what we'll refer to you as during the performance period, but we do understand you may have a separate organization name. So we ask for your organization name if you have one. Of course, if you don't have a separate name and you're using the same organization name for your QCDR, you can just click that button to say it's the same as the intermediary name. As I referenced going through the slides, there is a technical partnership or collaboration field here. If you are collaborating with any other organizations to make up your QCDR qualified registry, you are required to put that information here, and you are required to have that signed written agreement in place by September 1st of the year preceding the MIPS performance period. Your tax identification number is required. And then we also ask you if you're planning to support both intermediary types. Are you planning to act as a QCDR and a qualified registry? And then this next field is the intermediary staff access, very similar to the managed watchers that we discussed up here. However, as a new form, you will have the question populate down here as well to make sure you're able to provide that information. So again, anybody you would like to have access to the self-nomination, please type into this field, but please make sure they have the necessary accounts to be able to access the self-nomination tool and log in. We also will request your address, your organization phone number and website. and then contact information. We will ask for your main program contact, your clinical contact, as well as your technical contact. We'll request the names, the phone numbers, and the email addresses. And we do ask that those are 3 different people. We have instances where folks either leave an organization, go on a vacation, and maybe medical leave, where the main person we usually work with aren't necessarily in the office when we need to reach them, or in the office when some big deadline is coming up. So having multiple folks contact information does help us in keeping your organization up to speed on all of those deadlines, making sure deliverables are submitted on time, meeting requirements and such. So we do ask for 3 different contacts. Now, this additional contact field, clear at the bottom here, is where we will let you type in anybody and everybody you want to receive the information from our PIMS team related to requirements, deadlines, support calls, things like that. So anybody you want to include information or you want to receive information for the 2024 MIPS performance period, please make sure to include their email addresses here, and then they will be included in the 2024 distribution list. If they are not included in the self-nomination form, they will not be included in our 2024 distribution list. So please add everybody. Now moving, since we've completed going through this tab, you can see we've scrolled all the way to the bottom. There are 2 different ways to move to the next tab. You can either click the link on the bottom right to take you to the intermediary details, or you can use this left navigation pane. So this tab is partially completed. We'll continue filling it out as we go through and ensure that we have a green check mark as we finalize this tab. So the intermediary type, you will select what type of intermediary you are. Are you a specialty society, regional health collaborative? Are you a health IT vendor, an HIE or an RHIO or a collaborative? Or are you something else? And if you are something else, we do ask you to describe what it is that you are. The next field is whether you've participated in MIPS or PQRS in the past. If you're a brand new QCDR, then we would expect you to say no, or excuse me, new. If you are an existing QCDR, we would expect that you'd hit existing, and then you would select the years you have participated in either PQRS or MIPS. I do want to note that this is specific to the intermediary type. So when you're completing this, it should only be based on your QCDR participation as a QCDR or your qualified registry participation as a qualified registry. If you are an existing QCDR qualified registry, an additional field will pop up to ask if your organization has participated in the last 2 MIPS performance periods. And then if yes, it will take you to the additional information related to the participation plan that we discussed earlier. So it's asking you if you have submitted data within those last 2 years. And if you have not submitted data within those last 2 years, then you will be required to submit a participation plan. So the answer, if you say no, then of course you're not required to do one because that means that you submitted data. If you did not submit data, you are required to submit that participation plan that we detailed earlier within the slides. And again, additional information is available in the user guide. Next section on this tab is alternative names. We understand that you may use various acronyms, other names, historical names. We have some intermediaries that have participated since 2008. So, names may change. Organizations may be acquired from other folks. New acronyms may be developed, things like that. So if you are continuing to participate and your name's changed, you're using an acronym, anything to that effect that we may need to see, we would ask you to go ahead and put that information here. That way, if for some reason you're referencing yourself as that particular acronym or that other name, we have that information to track accordingly. So we would ask you to put that there. If for some reason you're not using an alias, any type of acronym, you can just check the box saying you aren't. The next section here is QCDR details, QCDR clinical specialties. is the first item here, and that's just what specialties are you supporting. There may be some folks who support all QCDR or all QCDR clinical specialties, and there may be some that just do a specific set, maybe cardiology, maybe pathology. So we would just expect you to put any and all specialties you support in this field. The next one is, do you plan to submit QCR measures for consideration? And this particular question is only applicable to QCDRs. So if you plan to submit QCR measures for consideration, you click a yes here. And then, of course, if you click yes, you will see this QCR measure tab that I have down here further. I won't detail that too much, as we will have a QCR measure submission demonstration here shortly, but I did want to cover this particular question here. Now, if I decide that I do not want to submit QCR measures for consideration for the 2024 MIPS performance period, I would just say no, and as you can see, that QCR measure tab disappears. So for the purposes of my portion of the demonstration, I'm going to keep that as a no, but again, we'll have a QCR measure submission demonstration here shortly. The next section of this tab is the definition of a QCDR. We already went through that definition, but this is where you will detail how you meet the definition of a QCDR. What type of QCDR clinical expertise do you have within your organization? What type of measure development experience do you have? Who are you partnering with or collaborating with, and what roles do they play within your QCDR to meet that definition of a QCDR? How does your QCDR do patient and or disease tracking, and what methods do you use to foster quality improvement? So we do collect all that information if you are wanting to be a QCDR to ensure you do meet the definition of a QCDR. Now, one thing I will note is we don't expect you to just simply say we have clinical expertise. We do expect detailed information in these fields to really substantiate that you have all of that necessary expertise and experience, and the information you put in this field will be covered with CMS and discussed further. So please make sure to provide detailed information within that section. As you can see for this tab, we do have the green checkmark circle. So we've completed this tab, and we'll go ahead and move on to the next tab, which is the qualified posting details. The qualified posting is actually a document CMS will post on the QPP resource library that is a list of all of the approved QCRs and qualified registries for a particular performance period. There's already at least several years of samples out there on the resource library. If you're new and you want to take a look at it, you're welcome to. 2023 qualified postings would be the most recent, but we will take exactly what you put on this tab for the purposes of that qualified posting. So we strongly recommend that you really review the information that you put in here to ensure that there are no spelling errors, or that the information being conveyed is 100% accurate. For example, we collect cost information. We would really hate for somebody to mistype in their cost, have it published on the CMS website, and then there have to be some type of issues after the fact. So we'll go through these fields. But again, just keep in mind that all of the information on this tab will eventually be published on the CMS resource library. So for cost information within this field, we do ask that you publish the information of how much you charge your clients for various services, how frequently those are. We know that some folks will charge annually, some folks will charge monthly, some people will charge per episode and per service. So please make sure to detail that information, but also please make sure to detail if the pricing changes for various submission levels. So for example, if you charge one thing for an individual submission versus a different thing for a group submission or an APM submission, we would expect that information to be included here. We would also expect information to be included if for some reason you charge different prices for various services, like reporting for all performance categories over just one, reporting for clinical quality measures versus MVPs, things like that. The cost information included in this section should be easily able to be understood by the clinicians for the services they're likely wanting to sign up with your organization for. The next field here goes into a little bit more detail there then and asks for the services that are included in that cost. So if you have specific things that are included in the price that you're charging to your folks, we would expect that you would put that in there. The next field is the last date you'll be accepting new clients. So of course, the 2024 MIPS performance period would run from January 1st, 2024 through December 31st of 2024. And then of course, the submission period would fall from January 1st to March 31st of 2025. I currently have a date in here of 12/31 of 2023. Obviously, that's before the MIPS performance period even starts. So that's probably not a good date for the particular 2024 MIPS performance period. Sometimes we'll see that folks don't either update it from the year prior, from a prior self-nomination, or just the dates don't quite make sense. So we will ask you if for some reason it seems like the dates don't make sense. If for some reason it's accurate, of course, just let us know. But I'm going to go ahead and just change this out to a more applicable time frame. We, of course, want you to set this date with whatever makes sense for your organization. We understand that there's certain requirements you have to meet, like data validation. So you may not want to be accepting clients up until the deadline of the data submission period. As again, you would be expected to be able to attest to that data being true, accurate, and complete. And if you're receiving data on March 31st, you might not be able to do that. So you'll just need to assess with your organization when you guys need to cut that off. And then, of course, put that on there. We would not look for any dates to, of course, be after March 31st, because if you are signing up new clients after the data submission period has closed, obviously, there's not much you can do for them at that point. The next section will collect additional information about what types of things you're supporting, data collection methods, how you're going to collect data from your clients. We know some QCDRs and qualified registries may use just one method, some may use all of these, and then some may use other methods we don't have included, and which of course we would ask you to detail that information. The next item here is performance categories reported. Promoting interoperability is the only one you can actually unselect. As we mentioned during the presentation, all three performance categories are required. However, the promoting interoperability performance category can be exempted from if for some reason the exception is met. And of course, if for some reason you do meet that exception, we request additional information as to how you meet that exception. So if you do unselect promoting interoperability, we will ask you to include that information. The next section is the reporting options supported. There's traditional MIPS, there's the APP, and then there's MVP. The same with MVP. MVP is actually required for our QCDRs to support the way the rule is written. It does say that QCDRs and qualified registries are required to support MVPs that are applicable to their clients. So MVPs are required. If for some reason you don't have folks who are applicable to any of the MVPs out there, then you can certainly unselect MVP, and then similar to the promoting interoperability exception we had above, we would just ask that you put the information in here as to how you're meeting that exception. Participation options are the next. So that's the level in which your clinicians or your clients are planning to participate through you. They might be MIPS individual clinicians, groups, virtual groups, APM entities, subgroups, and we would just expect that you would select all of these that are appropriate for your organization. I will note that if you are reporting MVP, subgroup reporting is required. And of course, if for some reason you are supporting virtual groups, we do ask that you include the virtual group specialty parameters within the field as well. That way the clinicians have access to that information and can easily look for QCDRs and qualified registries that are supporting their specialty. Moving on to the next tab. This is a tab of just participation requirements. We'll briefly cover these, but we do request that you read all of these in depth and ensure that you do meet these. You are self-attesting to meeting these requirements within your self-nomination. So if for some reason you have additional questions about these attestations, these requirements, or you feel you can't meet one, please let us know. And of course, don't select yes if you don't meet it. So the first one is just saying you'll attend and complete training and support sessions in the form and manner specified by CMS. The next one is talking about having previous experience collecting and transmitting data. The third one is the certification statement we referenced within the presentation, saying that all the data that you'll be submitting is true, accurate, and complete. And then the next one is just acknowledging the fact that you do have the ability to randomly request and receive documentation if for some reason your organization has been audited or CMS requests to review the data further. The next one is attesting to meet the 25 participant requirement by January 1st of the year prior, just to ensure that you do have that requirement met. The next one then is just indicating that you must be able to identify, track, and submit clinicians who are interested in participating in MIPS, but also as their opt-in, their voluntary status if for some reason they are not MIPS eligible. The next attestation is just the feedback report requirement that, again, we have detailed in the slides. So just attesting that you will meet all of those requirements as specified in the rule. And the next one is understanding that failure to meet any of those qualification criteria in compliance with the program may result in remedial action or termination. The next item is attesting to meeting the US requirements for your primary place of business and retention of the CMS data. And then the next attestation is that you will provide services for the entire performance period and not withdraw or change the measures, anything to that effect, as our biggest goal obviously here is not to penalize any of the clinicians that may be supporting, reporting through you for the purposes of MIPS. Another one is also to use the validation methods that are currently in place for promoting interoperability and improvement activities. Another one is that you'll support all payer data, not just Medicare Part B. All sorts of attestations here. The next couple here are using the CMS specified method of secure method for data submission. And then that your data validation process will be submitted to CMS, but also implemented fully, and the results will be submitted to CMS. So if you can attest to in detail, of course, in more detail than I've read through them, then we would expect you to read these and check yes as you go through. Again, if you do not meet one of these requirements, you'll not be able to participate as a QCDR qualified registry for the MIPS performance period. But if you do meet all of these requirements, you can certainly attest to meeting them. And then we will just accept the yeses throughout there. And then the person who is signing off on meeting those requirements at the bottom. If for some reason you don't have one of these marked, or your signature, your electronic signature is not there in the bottom, then it will not turn green and you won't be able to submit your self-nomination, as you do have to meet those requirements. We have turned that tab into the green check mark, so we'll move on to the improvement activities. And I will note these next couple of tabs will go really quick just because they are set up exactly the same. So we'll go through the first one in a little bit more detail, and the next several we'll kind of skip right through. So this first one is the improvement activities. You will select what improvement activities you plan to support for the 2024 MIPS performance period. Please keep in mind that for improvement activities, promoting interoperability, the measures, the MVPs, we understand that the 2024 proposed rule has not come out at this point. And of course, the final rule has definitely not come out at this point. So we are basing our measures and activities at this point on the 2023 physician fee schedule final rule. We ask that you self-nominate based on the measures available in the 2023 rule. And then after the self-nomination period, once we are aware of what's been finalized in the 2024 physician fee schedule final rule, we will allow our approved QCDRs and qualified registries an opportunity to update those measures as such. Of course, if there's a measure that's been retired from the program, we'll remove that off of your list. But if there are new measures or activities that are added, you'll also have the opportunity to add those onto your list. So that applies again to the next several tabs here. But again, we'll go through here. For improvement activities, you will note that we do have the view activity descriptions in case you do want to access or see additional information available within that. These links on all of these future tabs will take you right to the measure functionality on the QPP website to explore measures and activities. Make sure you're selecting the appropriate drop-down year. Again, right now we're referencing 2023 since the 2024 rules aren't available. You'll also have the ability to change to quality measures, promoting interoperability, and of course the cost measures, but we're not collecting any type of cost information at this point in time. Let me shrink down and go back to the correct tab here. With that as well, we would expect that you would either support all improvement activities, or if you're only planning to select certain ones, you can select the sum option and then select the particular improvement activities you plan to support for the performance period. Once you check a certain box, you will see that the measures you selected, or the measures or activities you've selected, will populate towards the top, and then you can confirm your list to ensure that you have all of the improvement activities supported there. So we'll go through these next couple of tabs. As you can see, this tab looks exactly the same. You have the option to view those measure descriptions. You have the option to select all, some, or none. In this case, you are allowed to select none just because there is that promoting interoperability exception. If you do meet that exception, and on the qualified posting details tab, you have indicated that you meet that exception, we would expect that you would click none here. But you also have the option to click some, and then you'll select whatever promoting interoperability measures you plan to support for that particular performance period. And you'll see the next couple of tabs are exactly the same. You have the option to select all, some, or none. From a quality measure perspective, we would expect that each QCDR qualified registry is supporting at least 6 quality measures. Now that can be comprised of clinical quality measures, also known as CQMs, or electronic clinical quality measures, or ECQMs, or QCDR measures. So throughout the QCDR measure tab, which again I've removed from the self-nomination, or the CQMs and the ECQMs, we would expect at least 6 unique measures. But of course, these tabs look exactly the same as that improvement activities tab, where you can review that information, the measure descriptions, select all, some, or none. MVP is set up the exact same way, where you can view the MVP descriptions and again, select all, some, or none, depending on how you plan to participate for 2024. The next tab is data validation. So we will go through briefly these elements that you're required to validate. I do want to note that you should explain in all of these fields exactly how you plan to validate that information, rather than just stating we will verify. So for example, in this first question, just simply saying that we will verify MIPS eligibility does not suffice. We do need you to detail how your organization does plan to do that. So on the data validation here, we do expect that you will detail how you're planning to verify the MIPS eligibility, how you plan to verify the accuracy of TIN and NPI identifiers, how you plan to ensure that the reporting rates and performance rates are accurately calculated and submitted to CMS, how you plan to ensure that 2024 versions of measures and activities are reported for MIPS submissions. And then the final 2 here are how you plan to complete your required data validation audit and then targeted audit if applicable. The data validation audit does require you to sample at a minimum 3% of the groups, individual clinicians, APM entities, and so on that you plan to support for that year, with a minimum of 10, maximum of 50 for all performance categories supported. And with that, at least 25% of the clinician's patients, with a minimum of 5 patients, maximum of 50, must be reviewed for all measures applicable to that patient. Now, if for some reason something is found, some type of data issue, data error is found within the data validation audit, you are required to complete a targeted audit. The rule does specify that the targeted audit does need to have a unique sample compared to the data validation audit, but at least include the minimum thresholds included in that data validation audit. So it must include the 3% with the minimum 10, maximum 50, and the 25% with the minimum of 5, maximum of 50. Again, all of this information is conveyed in the rule, but also in the self-nomination fact sheets and the user guide if you need additional information. The final tab here is our benchmarking capability. QCRs are required to have benchmarking capability. So I've already selected a yes, and then there's just an option here to select to upload your benchmarking methodology. You can use the drag or drop option if you'd like to drag or drop it, or you can certainly just open up and then navigate within your Windows Explorer here to open a particular file. So we'll just upload a file. And as you can see, uploading that file turned my window to the green check mark. As of right now, we have shifted everything to the draft complete status because everything down the left navigation pane has now been completed. And so our status is no longer draft in progress, it's draft complete, and this is ready to be submitted for CMS review. So we'll just go ahead and hit that submit for review button, and we'll confirm that we want to submit it. And then you will see that the self-nomination is now in self-nomination review. So that is the gist of the self-nomination process. Again, I just want to refer folks as you're going through your self-nomination, please use those resources available like the self-nomination fact sheets and the user guide to help walk you through that. If for some reason additional questions come up, do not hesitate to use the QPB Service Center or the comment fields within the self-nomination itself to ask questions or follow up on the status of your self-nomination. With that, that concludes my portion of the self-nomination demonstration. So I will actually turn the call over to Marla to begin. Oh, I'm sorry, Olga, to begin some of our QCR measure submission information.
Thanks, Anastasia. So the next several slides will be a quick overview of helpful QCDR measure information that will assist you in your self-nomination. Next slide. So to submit QCDR measures for CMS consideration for the 2024 self-nomination period, you will want to navigate to the 2024 QCDR measures tab. If you're borrowing QCDR measures, then permission to use those measures must be obtained prior to submission. For those that borrow measures, we only require a limited information to be completed within the Measures tab. The final QCDR measure specifications will then be populated by the PIMS team from the measure owner. If there are QCDR measures from the prior submission period within the Measures tab, and you do not want to self-nominate them for this upcoming self-nomination, then we ask that you select the withdrawn status for those measures. Those QCDRs that are in good standing will have a pre-populated QCDR measure tab that will include information from the 2023 approved measure specifications. In the case that there are new fields for 2024, those may be empty. The required fields to be filled out will vary based on measure owner status, measure adoption, and whether the QCDR measure is new versus existing. Next slide. So now let's review the requirements. New QCDR measures at a minimum must have face validity prior to self-nominating. Any QCDR measures that were approved in prior years are required to be fully developed and fully tested prior to self-nomination. Fully tested includes face validity, feasibility, and reliability at the measure score level. Fully developed includes validity, feasibility, reliability at the measure score level, and patient encounter level data element testing. Next slide. We suggest that when you are completing your testing summaries within the QCDR measures tab, you include sample size, statistical results, and interpretation of testing data. A great resource to refer to is the CMS MMS Hub for any additional testing guidance. To be included within an MVP, a QCDR measure must be fully tested. Next slide, please. So a few suggestions for submitting testing data. Again, for new measures, face validity is acceptable. Beyond the first year, you would need empirical validity, which can be in the form of construct validity, convergent validity, discriminant validity, or predictive validity. For feasibility, you want data elements to be relatively easy to collect. So when you're doing any type of feasibility assessments, you want to assess the availability of data and susceptibility to inaccuracies. Also, if there's any burden of data collection, data entry, and analysis. In addition, you want to look for any barriers and implement the measure specifications, data abstraction, measure calculation, or performance reporting. You also want to be able to collect all information without violation of patient confidentiality, and you want to identify if there are any unintended consequences. Next slide. Some examples of reliability testing at the measure score level can include signal to noise, temporal correlation or random split half correlation using interclass correlation coefficient, Pearson's correlation coefficient, Spearman's correlation, or Kendall's tau correlation. Data element testing completed at the patient encounter level for each critical data element can be done by percent agreement, kappa, correlation coefficient, or positive predictive value. For data elements that are already established, such as age, you do not need to test for. Also, if you are completing, you only need to complete data element reliability or data element validity. Next slide. Prior to submitting any QCDR measures for CMS consideration, we really encourage you to review your full submission to make sure that there are no errors. Ensure that spelling and grammar is correct. When you are filling out your submission, you want to make sure that you're using the drop-down selections when appropriate. If there are changes to the measure that does not impact the intent, we would still like to know what specifically has changed. You also want to make sure that all the analytics are correct within the specification. And lastly, we do have a section called QCDR notes that you can use to communicate anything you may think is important that hasn't already been communicated within the documented fields that are already existing. Next slide. All right, so now I will pass it over to Marla Throckmorton for the QCDR measure submission demonstration.
Thanks, Olga. All right, so we are going to go through the demonstration of how to self-nominate a QCDR measure. For the purposes of this presentation, I want a disclaimer. If I say QCDR measure or if I just say measure, I'm of course referring to QCDR measures. As it's been mentioned, intermediary details is where you have to select whether or not, wrong one. Intermediary details is where you select whether or not you plan to submit QCDR measures. If you'll notice here with the radio button of no, there is no QCDR measure tab on here on the left pane, but once I select yes, it does provide this QCDR measure tab that we can use. I want to note that if you can see the bottom left hand of my screen, there should say a submit for review, and then underneath it is a red withdraw and a red reject. This red withdraw, this is strictly, everything in this left pane strictly has to do with the QCDR itself. This is not about specific measures or specific other items. This is strictly regarding the QCDR itself. So when I select this QCDR measure tab, it brings us to this landing page. This is where your home page essentially for your QCDR measures. Once self-nomination closes and we move to our next section, which would be QCDR measure specifications, that is a separate section that then will populate additional tabs over here on the left side to complete the entire QCDR measure review and finalization process. But of course, today we are only going to be talking about this QCDR measure tab, which is what is required for self-nomination. A QCDR may submit a maximum of 30 QCDR measures for CMS consideration. This tab itself is what we use to, this tab can be changed up until September 1 when self-nomination closes at 8 p.m. Eastern Time. Once we move on to this QCDR measure specification process, any updates that are made to the measures at that point will not be reflected here on this tab. So if you go back to look at your self-nomination tab and look at your submitted measures, know that they are in their original submitted form, not in the finalized form. If you are a QCDR in good standing, as we've noted, there's a pre-populated tab for those QCDRs. And so what you will see when you go to your QCDR measures tab is you will see all of your 2023 approved measures populated into this draft section. You will then have to go into each measure that is in this draft section and edit the details and make sure that the entire form is filled out for that measure. So let's go ahead and look at this measure that I have initiated as a owned measure. That's a new measure. This, as a new measure, you will see this temp ID. This stands for temporary ID. And it has the 2024, of course, is for the year. And then there's a just an assigned number, but this will be the measure ID until after it's determined whether or not this measure is approved to move forward in the program. So once we edit our details, you'll see here at the top of the page, there are 4 sections to be filled out. Once you fill out the required fields in each of these sections, these green check marks will occur, and that will let you know that this measure is completed and ready for submission to CMS. If there are any required fields that are not populated, this submit to CMS button will not be made available or will not be active for you to be able to utilize. Also, I'll show you here on the bottom left-hand side of the screen is a red withdraw button. If you select this, this withdraws the measure, the single measure that you are intending to withdraw. So let's go through each section. There are different types of fields. There are text fields, there are radio buttons, there are drop-down lists. So each one has its own, there are different types that you can use to fill out this form. Please note that you can hover over this question mark and it will give you a brief description of what is required for this field. The red asterisk indicates whether or not it is a required field. So measure title, obviously it's a text field. You will fill in measure title, measure description, denominator, numerator, any denominator exclusions. So if you'll see here, let's say you do not have a denominator exclusion in your measure. You still need to enter none or not applicable, NA. You still have to enter characters into this box for it to recognize that you filled out this required field. Here is our first option of using a drop-down list. So this is primary data source used for abstraction. It's a required field. If you know already what type of data source you use, you could actually start typing it, like if you wanted EHR. Or you can scroll down and select the ones that you want to select. So now we selected administrative claims, data, and then claims. If you'll look up here, you have an option of deleting one at a time if you decided, oh, I clicked the wrong button. Or you can actually clear all of them that have been selected and start over. The CBE ID, formerly known as an NQF ID, this is an optional field. You can leave it blank or enter NA, or of course, if your measure is endorsed, then you would write in the endorsed ID. We do have some questions such as high priority measure. If you answer no, then you would move on to the next question. But for example, high priority measure, yes. Then it also then gives you an additional question to answer. We want to also answer our high priority type. If you'll notice here, it says select one. Up above where we looked at, for example, primary data source used for abstraction, you could select a number of different types. But for these, you will see it'll indicate whether or not you can select more than one. So high priority type, let's say it's care coordination. Measure type, again, these are filled out with the CMS accepted measure types. Select one. Care settings, again, you can select multiple settings. If you believe that your measure impacts or can be measured in all settings, of course, select all settings. If you believe that it only can be done in an imaging facility, then you would select imaging facility and have multiple care settings selected. Does this measure include telehealth visits or codes? Yes or no? And now we'll move to the next section, which is the analytics section. Measure calculation type. Is it an inverse measure? Is it a proportional measure? You can actually select multiple types of measure calculation. Number of performance rates to be calculated and submitted. If these are easy radio buttons, up to 10 different performance rates. If there are, let's say you only have one performance rate, it is required to enter this answer. If you have one performance rate, or if you have, let's say, 3 performance rates, as in my example down below, when there's only one performance rate, it's optional to enter a description of your rates. But even if I select 2 or 3, this performance rate description still states as optional. But we do require, or we do ask that you fill out, once you have more than one performance rate, you do fill out this performance rate description. And the requested format is to say rate 1, describe, rate 2, describe, and example, rate 3, overall rate, describe. We would then want you to indicate which one is an overall performance rate. We do have up to those 10 rates listed here, but you also have the option of having a weighted average and a simple average. In the example, we said rate 3 was overall rate, so I selected the 3rd performance rate. Do you plan to risk adjust? No, you would skip to the next question. If you do say yes, then you have to enter a detailed description of which score is being risk adjusted. And then we also ask that you upload your risk adjustment files. It is my understanding that there's also a risk adjustment section as you fill out one of the other tabs. You can use the same file here. If not, then this year we were hoping to update it where this would be the only place that you would have to upload that risk adjustment file, because it does only impact your QCDR measure. As you can see, now that I said, do you plan to risk adjust? Yes. So now I don't have all my required fields filled out. Then I no longer have the submit to CMS button available to me. So I'm going to change that back to no, so that the required fields are filled out. And as you see, this submit to CMS button became active again. Is the QCDR measure able to be abstracted? Yes or no? This is a disclosure statement. Does this measure require the use of proprietary software, devices, etc.? This question is intended to determine whether or not a clinician would then know whether or not they would need to be charged any additional amounts or need specific software devices in order to collect data on this measure. Our next section is our testing section. Was the QCDR measure tested at the individual clinician level? Yes or no? And then we just have these text boxes for your validity testing summary, your feasibility testing summary, and your reliability testing summary. For new measures, all that is required for your first year in the program is face validity. Of course, if you have completed your testing for the measure, then we highly encourage you to go ahead and fill out all 3 sections. But if it's an existing QCDR measure, it's been in the program prior, then you do have to provide, even though these say optional, if it's an existing measure, all 3 of these testing summaries are required. For patient data element testing, if you did it under as a patient data element validity testing, you would include that as part of your summary here. Or if you did the patient data element testing for fully developed definition and you did it under reliability, then of course you would include it here in this reliability testing box, summary box. Then our last section is our supporting documentation. Describe link to cost measure improvement activity. This is required. If there is no link, you would have to explain why you don't believe that there is a link available to a cost measure or improvement activity. All measures currently can be reported versus traditional MIPS. So this box is selected for all measures, traditional MIPS. But if it is a measure that is included in a MIPS value pathway and you're reporting it as such, then you would select the MIPS value pathway box as well. Clinical recommendation statement. You would input why is this measure clinically recommended? Why is it an important measure? Rationale for the QCDR measure. Performance data, this is required. We recommend that you insert it as number of months the data was collected, the average performance rate, the performance range, and then the number of clinicians or groups that the data was collected for. This performance data doesn't necessarily have to be data that was reported to the MIPS program. For example, if you were working on getting a measure ready for its initial submission, you collected data to prove that it was a valid, feasible, reliable measure, then you can use data that was collected just by the QCDR. As Olga mentioned, if you do have an existing measure and you made changes, we would like for you to go ahead and indicate what has changed to the existing measure. This just helps us focus our review, helps us really pay attention to parts of the measure that we need to see, whether or not it was a large enough change or an impactful change that would require a new measure ID, would impact whether or not the measure should be approved or not if it had been approved in prior years. Can the measure be benchmarked against the previous performance data? This is optional because new measures, of course, cannot be benchmarked since they haven't been in the program. So it would be yes or no. If applicable, please provide details why the previous benchmark can or cannot be used. Of course, we're really more focusing on why the benchmark cannot be used. And that would also play into what had changed in the measure so that the benchmark is no longer applicable. If you want to provide study citations to support your performance gap, to augment your performance data that you have submitted, then you can add those study citations here. If applicable, provide a participation plan if QCDR measures has low adoption by clinicians. If a measure has been in the program for greater than 2 years and you do not have an established benchmark, then this is when you would provide a participation plan for CMS to review. This would be, you can do things like require that the QCDR measure be reported as part of the participation in your QCDR education and outreach plan to your clinicians on getting more clinicians to report this measure. You would explain how you are going to increase this adoption. Then we get to the please indicate your specialty or specialties that the measure applies to. You can also select all specialties, or you can select individual specialties. Then your preferred measure published clinical category. What these specialties and the clinical category sections are for is because this helps, especially the clinicians, once the QCDR measure specifications are published, this would help a clinician to think, okay, I am an anesthesiologist, so I'm going to search for anesthesiology based measures. And then last, we have this QCDR notes, which are optional. You can write, for example, if there was harmonization or resolving of areas of duplication with another QCDR measure that you wanted to talk about those efforts, you could enter that here, or any other information that you feel is really important for CMS during the review process, and you didn't see another place that it was applicable to enter that information. If you do have any other additional supporting documentation that you want us to review, then you can drag and drop those files here and have those available for us. You have a couple of options. This save and close button would be that you've entered everything, you've done a quick run through, you just wanted to get the information in there, you can save and close and come back to it. It would still stay in that draft status. But you've gone through it multiple times. You know that you have every piece of information that you want to include. All the quality assurance, grammar, spelling, etc. has been completed. Then you can submit this measure to CMS. You have an option to review each of the fields. And then you can certify and submit. Or if you decided, oh no, there are some issues that I see that I need to edit, then of course you can cancel this submission. We're going to go ahead and certify and submit. And as you can see, it moved from the draft status to the submitted status. All QCDR measures that you want CMS to review for approval for the 2024 MIPS performance period have to be in submitted status. If on September 1st, they stay in the draft status or the non-active status, those measures are not pushed forward for CMS review. So only measures that are submitted. You do have the option, even after we submitted, it's before September 1 or before the close of self-nom, and you decide to edit those details, you can, again, have this option to edit those fields. Non-active is where withdrawn, retired, and rejected measures are housed. There aren't any currently here. But for example, with your self-nomination, you had pre-populated measures. So let's say you had 10 measures that you supported last year, and you decided that 2 of them, you've just decided that you're no longer going to support those measures, or your data is not showing a performance gap, you're not seeing value in those measures, then you would have to actually enter that measure as a draft, go into that withdrawn section and withdraw it, and then it will live here. So let's see about adding a QCDR measure. The first question that you are asked is, do you own this measure? This answer is going to determine what fields are going to be required to be populated by you. So let's look at a borrowed measure. Do you own this measure? Yes, of course, you're the owner. Co-owned means that you co-own the measure with someone else. Or do you own this measure means that you are going to borrow that measure. If this measure has been previously approved by CMS, you can select yes. And if you know the exact QCDR measure ID, you can type it in here and select find measure. That will populate the fields that it needs to populate for you. That does not mean it is going to comprehensively answer every single required field, but at least gives you the basic framework from last year. You can click here to download all the approved measures from 2023 so that you could look up the measure IDs that you're trying to search for. Again, before you self-nominate a measure, you have to have permission from the owning QCDR. For the purposes of this demonstration, we're going to go with a We're not going to say it was previously approved by CMS. This is borrowing a new measure. Measure title, measure owner, your documentation of approval from the other QCDR. You drag and drop that file or attach it. It can be a letter, it can be an email, whatever legal documentation that you have that says that you have approval from the other QCDR to self-nominate and then support this measure during 2024. There are a few questions that are asked that can vary slightly from the owner. Is the QCDR measure able to be abstracted? Of course, we are assuming that the QCDR measure owner is able to extract their measure, but you as a new, if you're supporting this as a new measure, we want to make sure that you have gone through your due diligence and here you're attesting whether or not you are able to abstract that data. These next few questions really have more to do with the owner of the measure. If you do not know what whether or not it requires proprietary software or devices, you can answer yes or no. Just know that this will the owner's measure specification will be considered the source of truth, and we will. If you answer differently than the owner, we will be researching that to make sure that the correct answer is being populated by the owner, as well as yourself. We will then reconcile those answers. Primary data source used for abstraction. You could have a different type of hybrid way that you abstract your data versus the owner only uses claims data, for example. Validity testing summary. This is up to the owner. Again, you can say see owner's specifications. Same thing with the link to the cost measure or improvement activity. These are both optional. If you do work closely with the measure owner, they give you this information, you can populate it here. Again, traditional MIPS is selected for all QCDR measures, and then you would determine if this measure belongs in a MIPS value pathway, and you are going to choose whether or not you're going to be reporting it as such. If you collected data, if this is not a new to you measure, you're still borrowing it, and you have collected your own data for this measure, then you, as you should, then you would put in the performance data that is specific to your QCDR here. Your specialty may be different than the owner's specialty, as well as what you want this measure to be published as a clinical category for. You also have an option of entering QCDR notes here, and then any additional supporting documentation that you want to enter. We're just going to save and close. And now I have a draft. Again, once I finish that, have everything required, then I could submit that to CMS. Do you own this measure? Now we're going to say, yes, we own this measure. Has it been previously approved by CMS? Again, if it wasn't already pre-populated in your draft section and you need to add it, then you will add this yourself. And you would enter your assigned measure ID. If it's an existing measure, we prefer that you go ahead and search your assigned measure ID, because then this does allow that measure, existing measure ID to be pulled forward. On the back end, if you entered it as a new ID and it is an existing measure, we do have to do some work of research in determining that it's an existing measure. So if you are, for example, if you withdrew the measure accidentally and now you're having to re-enter it, please use the existing measure ID to start the process of populating this measure. But if it is a new measure, then you'll see we have the 4 sections that have not been filled out, and you have to enter the whole gamut of fields for this measure, as discussed with the very first measure that we looked at. Again, since I'm not entering all of the required information, I can only save and close. I cannot submit it to CMS. And now I have an additional draft. The last way that you can submit a QCDR measure is if you co-own it by 2 or more QCDRs. I know that there are some QCDRs that co-own measures with entities that are not qualified clinical data registries. In that instance, we do not necessarily need to know who the co-owner is. That is something between yourself as the registered clinical quality data registry and the other entity. You can enter their information if you would like, but know that it will not necessarily be published since they're not an accepted QCDR. Has this measure been previously approved by CMS? Again, you can select yes or no and search for that measure. Are you the primary steward of that co-owned measure? This is an internal designation only for CMS's use during measure review. At this point, we tend, if there's a co-owned measure that, let's say it's ABC QCDR's measure and the measure ID is ABC1. Well, we tend to lean towards that ABC QCDR as being the primary steward. If it was, a different, I'm not good at on the fly making up QCDR names, but if it was the other co-owner, you can select no, that you're not the one that originally owned the QCDR. But just please know this is strictly an internal designation. You do need to enter the official QCDR names of the measure owner other than yourself. Of course, by you being the one entering this information, you're listed as one of the co-owners. Then here you would just need to list the other co-owner's name. Please separate multiple names with a semicolon. Since this is considered an owned measure, again, you would have to go through the entire form. I just want to reiterate again, by September 1 at 8 p.m. when self-nomination closes, all measures need to be in submitted status or non-active status. You cannot leave them in draft. I know that some people have stated that they thought because they were pre-populated here in the draft, that they thought that was all that was needed to be done. And please know that that is not accurate. You still need to open each measure, go through the process of verifying everything is filled out accurately, most up-to-date information, and then move them either into submitted status or the non-active status. If you are a QCDR that did not receive a pre-populated draft section, you would just go into this add QCDR measure and enter each measure. As we talked about, if you are doing the maximum of 30 QCDR measures, then that does mean that you have to add this QCDR measure 30 separate times. If that is, there's not a way to do a mass upload is what I'm trying to say. You would have to add each individual QCDR measure. All right. Thank you so much for your time, and we look forward to receiving your self-nominated QCDR measures.
Hi, everyone. I'm going to be going over some resources that are available should you have any questions or run into any issues. Next slide, please. All of these items can be found on the QPP website. The MIPS Explore Measures and Activities tool is where you can look to find measure specifications and supporting documentation. The QPP resource library has a variety of program information and other documentation that you may find useful. The QPP webinar library is an archive of past webinars that you can review, and you will be able to find today's slides on there once they've been posted. And if you have a question or run into any issue that isn't covered in the documentation, you can submit a QPP Service Center ticket that will be routed to a subject matter expert that will be able to assist you further. And finally, there is also the QPP listserv, which you can sign up for on the main QPP website. This is where we share important program information and other updates. Next slide, please. And here are some instructions and best practices for submitting a service center ticket. Please note that when you submit a ticket, it should be a new email addressed directly to the QPP Service Center and not a CC or a forward. And the address for that is listed here on the screen. Next slide, please. And here I'll turn it back over to Ketchum for the Q&A portion.
Thanks, Dan. So it looks like we are running up close to the end of this webinar, so we're going to try to get to as many questions as possible. But yeah, we're going to go ahead and start the Q&A portion. And for this Q&A, again, you can ask questions through either the Q&A box or through the webinar audio. And to ask a question through the webinar audio, please raise your hand and we'll unmute your line so you can speak. And actually, to start us off, we're going to go over to the phone lines. And Diana Stillwell, thank you for your patience. We have unmuted your line, so whenever you're ready, go ahead and ask your question. Diana, it looks like you're muted, so you might need to take yourself off mute. Okay, we'll come back to you a little bit later on. All right, so now we're going to turn our attention over to the Q&A box. And our first question reads, if we support a particular MVP but cannot get permissions from the owner of included QCDR measures, can we still nominate that MVP?
Hi, this is Olga from PIMS. Yes, you can. CMS does understand that QCDRs may not have necessary permission to support the QCDR measures within an MVP. If you are unable to obtain permission, then you would not be required to report that QCDR measure.
Thanks. Okay, so the next question, and this appears to be a follow-up from a direct response from the Q&A box. This one asks, can you explain why most but not all clinicians are automatically accepted from promoting interoperability due to their statuses? Because this seems to be different from previous years.
This is Anastasia from the PIMS team. So the PI exception, the promoting interoperability exception, is actually the same as it has been in prior years. There's definitely language within the rule language as well as our self-nomination documentation. If you want to take a look at that, apply it for your organization or your QCDR or your qualified registry. But if you have clinicians that are expected to report promoting interoperability, then as a QCDR qualified registry, you should also be reporting that. Now, if you have questions on whether or not your QCDR qualified registry meets that exception, I would certainly submit a inquiry to the QPP Service Center, and then the ticket can be triaged to the appropriate team to help you identify how you meet that exception, or if you do.
Thanks. Okay, so the next question from the Q&A box asks, from the non-submission slide, is the participation plan different from the actual self-nomination?
Hello, this is April from PIMS. Can you hear me? Okay. Yes, the participation plan is different than the self-nomination itself. CMS will not penalize QCDRs and qualified registries that submit no data for 1 year. However, depending upon their MIPS data submissions from the last few years, these QCDRs and qualified registries may have to submit a self-nomination participation plan for CMS approval if that applies to their situation. The self-nomination participation plan is part of the self-nomination form and must include the QCDR and/or qualified registries' detailed plans about how they intend to encourage clinicians to submit MIPS data to CMS through the QCDR or qualified registry. For the calendar year 2024 MIPS performance period, a QCDR or qualified registry that was approved but didn't submit any MIPS data for either of the 2 years preceding the applicable self-nomination period must submit a participation plan for CMS's approval. This participation plan must include detailed plans about how the QCDR or qualified registry intends to encourage clinicians to submit MIPS data to CMS through the registry or QCDR. Beginning with the calendar year 2024 performance period / 2026 MIPS payment year, an organization that submits a participation plan but does not submit MIPS data for the applicable MIPS performance period for which they are self-nominated will be terminated. Thank you.
Thank you, April. So going back to the Q&A box, this next question asks if the data validation audit is exclusive to tax identifier numbers and national provider identifiers, since those pertain to clinicians. And then also clarifies that the person who asked the question is thinking of ACOs and groups for which tax identifier numbers and national provider identifiers are not applicable. Instead, TINs and ACO identifiers apply.
This is Anastasia. I can tackle that. With that question, within your self-nomination form for your data validation strategy, we would expect you to detail all of that information out, whether you are supporting individual clinicians at the TIN MPI level, groups at the TIN level, APMs at the APM entity level, virtual groups at the virtual group level, and then also subgroups at the subgroup level. So you would just detail that information out within how you're auditing for those organizations, and you would be expected to audit 3% of the individual clinicians, groups, virtual groups, subgroups, and APM entities that you are reporting. And so you can just include that information in your self-nomination.
Great, thank you very much. So you have one more question, and this one asks, do we call those out separately in the self-nomination form? And we're assuming those refers to ACO identifiers.
Yes, that's correct. They would just depict how they're auditing for those different submission levels.
Great, thank you. And another question asks, how can an MVP be reported by QCDR1 if the specific QCDR2 measure within the MVP does not have approval to use?
Hi, this is Olga. So you would be expected to support all the measures within an MVP. The only exception would be a QCDR measure where you are unable to obtain permission from the measure owner. But as far as all the quality measures that are within that MVP, those will still be required to be reported.
Thanks. Okay, so we're going to give it a few more seconds to see if any other questions come in. If you do have any other questions, please do enter them into the chat box. It looks like we actually do have one question on the phone line. So Gwendolyn Lowry, we're going to unmute you. And feel free to ask your question whenever you're ready. It does look like you're on mute, so you may need to unmute yourself on your end.
Hello.
Hi.
Hi. I didn't get the gist of a lot of it because it was going so fast and I didn't get in. I got the message that I needed to get in pretty late. I was just curious as to whether or not there were any pamphlets or booklets on the self-nomination and the QCDR measurements requirements.
This is Anastasia again from the PIMS team. So on the Quality Payment Program Resource Library, there is a self-nomination toolkit that's been published. There is a QCDR self-nomination fact sheet as well as a qualified registry fact sheet. And then a QCDR measure handbook if you're planning to support QCDR measures. And then we also have a self-nomination user guide that walks through the self-nomination step by step. So definitely available out there on the QPP resource library.
And that could be found where?
The QPP resource library, I think we can go ahead and post a link to that in the chat for you to make it easier to access. But the direct link, just to read it out real quick, is qpp.cms.gov/resources/resource library.
QPP does CMS. Hello,
Yep. And they did just
QPP.
put in the, I'm sorry, qpp.cms.gov
Uh-huh,
/resources
uh-huh.
/resources. I'm sorry, /resource, no S on the end of that, and then -library, which that is in the chat box within the Zoom platform as well.
Okay, great. I thank you so much.
Does look like we're out of time, so that concludes the Q&A portion for today. Thank you everyone for all your questions. And just as a reminder, we will be holding that virtual office hours session for the self-nomination application process on August 17th. So if we weren't able to get to your questions today, we do encourage you to join us for that again in August. I will now turn it back over to you, Dr. Green, to conclude the webinar.
Thanks, Matt. Just want to thank everyone for your time and attention today, for dialing in. Lots of good questions. Hopefully you found the information helpful. We will look forward to receiving your self-nomination requests when self-nomination opens at the beginning of July. In the meantime, have a great rest of your day and hopefully a good day, a good kickoff, if you will, to summer. Thank you. Bye now.